Okay, people, let's continue with the methods of administering medicine to farm animals. As I've said earlier on, that we will start by looking at the methods of determining whether the animal is healthy or not. We have done that. Now we are looking at the methods of administering medicine to farm animals. We say the animal is sick. What can we do? Yes, we have to administer medication, but which method are we supposed to use? When we look at these methods, there are three things that are important. One, you must know the method that we are using. Two, in some methods, you must also know the type of medication that we are administering using that method. Then in other methods, you must know where is the medication administered in the body of the animal. So sometimes we'll say you use this method to administer this medicine to a certain part of the body. You use this method to administer the medicine that is in this type. So it's very important to know the name of the medicine, the name of the method, the type of method. To know the name of the method and the part of the body where the medication is administered. I have these five in this slide. One, we have mixing the medicine with food. This one is very simple. You take the medicine, you mix it with the feed of the animal, and then you give the animal to eat. When the animal eats the food, it will be SMS taking what? The medication. And what type of medication? What type of medication are we what type of medication are we administering in that case? We're administering medication such as what? Powder, or else medication in a form of what? Of fluid. So it's very important to know the type of medication. We have this number two, topical application. I would like you to focus on this one. Topical. Please underline the first part. Top. This method, we usually administer powder, ointment, lotion, and spray. If we say it's topical application, we are simply saying in this method of applying medicine, we apply the medicine on top. Hence we say it's topical. So we apply the medication on top. So it could be on top of the skin, whereby you will take the lotion, ugcobise ini la isilimele khona isilwane. Maybe si-affectwa yini ngama-external parasites. You can ungafika ugcobise la silimele khona. Maybe sinesilonda esithile, ufika ugcobise on top of the skin. So it could be used to treat in wounds or some of the external parasites. So we say that one, it's what? It's topical application. You treat whatever that is on the skin using the topical application. Take note of the type of medication that is used there. It could be the powder, ointment, lotion, or spray. I hope you get that one. We also have number three, the bowling gun. Bowling gun, please take note of ball. What we're doing here in the bowling gun, we are applying a type of medication that is solid. So we are applying solid medication, such as what? Such as pills, such as tablets, and such as what? Such as capsules. So you see that this type of medication, it's a solid medication. And which instrument do we use to apply this type of medication? It's an instrument that we call a bowling gun. It's very important to note this one. Number three, drenching gun. Take note of the type of medication that we use to apply here. It's what? It's liquid medication. And when we use the drenching gun to apply liquid medication, this liquid medication will go through the alimentary canal. So meaning, people, the drenching gun, even the boiling gun, when you administer the medication using these two instruments, the aim is to treat, internal parasites. That is the aim of using what? A drenching gun, because the type of medication that you administer there will go into what? Into the alimentary canal. So it treats all those parasites that will affect the internal part of the body. Hence we say those are what? Are internal parasites. We'll get to that one as we move along with the animal protection and control chapter. Then we have the last one, stomach tube. This one is simple. You just administer medication that goes straight to the stomach. It can go to the rumen. So this one is simple. In this one, I want you to master these three. I'm not saying the others are not important, but if you can master these three: topical application, boiling gun, and drenching gun. Topical application on top of the body. Boiling gun, use to administer medication in a form of balls or medication that is what? That is solid. The drenching gun, used to administer what? Liquid medication. On this one, people, what I will do on this one, at the end of the slides, I will show you a picture of a boiling gun and a picture of a drenching gun. Because why they sometimes do in the exam, they will just give you the picture of a boiling gun. Then they ask you a question: what is the name of that instrument? You're supposed to say it's a boiling gun. Another question may also come: what type of medication does it administer? You must be able to say, such as pills, tablets, capsule, or solid medication. Or else they can give you a drenching gun with the same questions. So it's very important to know the picture of it. But if you can master the topical, the boiling, and the drenching gun, you will be safe. Let's move on and look at this. We're still continuing with the methods of application. On this one, I will not take too much on this slide. You have the first one in this slide, cannula and toca. This one we say we treat diseases that affect the stomach. So in this case, we treat diseases that affect the stomach based on something that the animal has ingested. So it's very important to master this one. Rectal injection. The aim of administering rectal injection is to treat constipation. So in this case, we are injecting the animal. We are injecting the animal into the rectum. That's how simple it is. We're injecting the animal into the rectum. Vaginal infection. In this case, usually we administer it after calving, after the animal is given birth, or else if abortion has taken place. I hope you still reminisce the definition of abortion, because they are almost the same with miscarriage, but you do recall it. And the aim of using vaginal injection, you want to treat any infections that will affect what? The vagina. So in this case, you are injecting through what? Through the vagina of the animal. Then the next one, through the nose. What type of medication are we administering? It could be medication in a form of gas. It could be medication in a form of what? Of snuff. So those medications that can be inhaled through the nose. So we say you administer them through a method that we call through the nose. So people, you can see that snuff sifakwe emakhaleni asifaka kwezinye indawo. So it's very important to master that one. Okay, fine. Let's look at the other one. Let's look at the next slide. angijulanga kakhulu la. Let's look at the next slide. I like this one. Let's look at this slide. Sorry, I think there's something that will disturb us. Intramammary injection. Intramammary. When we talk about intramammary injection, we say the aim of the intramammary injection is to treat mastitis. Remember when we are talking about the lactation, which is milk production, we say there's that disease that will affect the udder. And that disease is caused by what? By bacteria. Hence we call it a bacterial disease. We said it's mastitis. Now we're saying, how can we treat it? How can we administer medication that will treat this disease, which is mastitis? You use intramammary injection. When you use the intramammary injection, you go to the teat canal. Remember the teat canal, we say it is the opening of the teat. You go to the teat canal and then you inject the animal through the teat canal. Then you have what? Intramuscular injection. On the intramuscular injection, what I want you to underline there, please take note of muscular. Since they say it's intramuscular injection, it simply means that the injection goes into the muscles. Please make sure that you master it in that way. We also have subcutaneous, but I like this name, hypodermic. I will try to explain this one in a very simple way. Hypodermic injection. Let's see where does the injection goes here. Hypodermic. Please underline hypo. Hypo simply means below. Then we have dermic. Dermic is taken from dermis, which simply means skin. So meaning, when we talk about hypodermic injection, it simply means that below the skin. So what type of injection is this one, which is subcutaneous or hypodermic injection? We are injecting the animal into the connective tissue beneath or below the skin. Take note of this part. Beneath or below the skin. Hence we say hypo simply means below. Dermic simply means skin. So we're injecting the animal below or beneath the skin. Then we are using what? A needle. I hope you master this one. Intravenous. Then intravenous, underline venous. Venous is taken from veins. So we are injecting this animal into the veins. So you can check what we want to treat heart water and milk fever, but we are injecting the animal into the veins. We want to treat heart water, which is a protozoan disease whereby the animal urinates. So we're treating heart water. Then we have the last one, intradermal injection. The last one in this slide, intradermal injection. Dermal again is also taken from skin. So meaning, what is happening here? We are now injecting the animal into the layers of the skin. It's very important to master this type of injections, because in section A, 1 or 2 of them will be there and they are worth 2 marks. So you must be able to get the 2 marks from each and the 2 marks from the other one. You have 4 marks. You move on and you move on collecting marks. Okay, fine. Let's look at it thoroughly. We say the people, we have intramammary injection. Intramammary injection ingena kuphi? Ku teat canal, the opening of the teat. Sabuya sathi sine intramuscular injection, lapho i-injection iya kuphi? Kuma muscles. Sathi sine hypodermic injection, i-injection lapho iya kuphi? Below the skin. Hypo below, dermic skin, so it goes below the skin. Intravenous, The venous is taken from veins. So where does the injection goes to? It goes into the veins of the animal. Intradermal. Dermal simply means skin. So intra, it goes into the mealy layers of what? Of the skin. It's very important to understand this slide. It's very important to master. You can even take time to look at this one up until you understand everything. Then we have this one. I decided to put this one. Remember we said on this one, remember we talked about what? The topical application. So we talk about the boiling gun, we talk about the drenching gun. So I decided to put these two pictures. We said we have a boiling gun, and try to recall ukuthi it's a boiling gun administer a medication. Is administer in a solid medication such as what? Such as amapilisi, such as what? Such as tablets. Then we have the drenching gun. Remember we said the drenching gun, we will administer what? Liquid medication. So bazokunika kanje ku exam bese bayakubuza ukuthi what is the name of this instrument and what is the name of this instrument. I kindly request you to know, to be able to identify them if ever bawabuza kuphi ku exam. Okay, fine. Let's continue. We are not done with the methods. We have these methods again. Dipping. Dipping ilapho khona, it's simple. Siyayithatha siyise edamne, zifike ziyangena edamu ziyadipha ziwelela ngaliyana, ziyangena ngapha then ziyahamba ziyowelela ngaliyana. So we say it's dipping. And if we nagi dipping, we want to treat what? We want to eradicate or treat what? We want to treat pest such as what? Lice, scabs and ticks. So in this case, these are what? These are external parasites. So meaning when we use dipping, we want to treat what? External parasites. Remember, when we use the drenching gun, we want to treat what? Internal parasite. So we also have spray races. Spray races is zibago crush. You find that it's a crush here. Then you have your animals, they are moving through the crush. Then you are spraying the animals here. You are spraying the animals from the sides. So we say it's what? It's spray races. And take note of this one. We're treating what? Ticks, mites, and flies. We're still going to talk about all of these parasites. So again, we are also treating what? External parasites. Then we also have hand dressing and hand spraying. The last one is foot dips and foot baths. Foot dips, it's almost the same to foot bath. Lesa khuluma ngayo, masikhuluma ngani nge-animal production. So in this case, we want to control nematics on sheep. Belly dips kungathi kungena ini lesisu sesilwane. So siyangena lapho to treat all those parasites that will be there. Then foot dips kungena ini only the hoofs, not the whole body, only the hoofs plus the belly. So make sure that you understand this one thoroughly, people. I would like you to know all of them in a very good way. So remember, we talked about all of them. But what is crucial here, what I would like you to note, please make sure that umbambela le topical application, boiling gun, drenching gun. Kulawa out2 ukwazi ukuyi-identify ukuthi siyibona ngani. Sibuye size ngapha la ungibambela onke. It could be the intramammal, intramuscular, subcutaneous or hypodermic, intravenous, and intradermal. It's very important to know all of them. And la kuzibambe kalula, uyazi ukuthi intramuscular and then muscular. So iya kuphi kuma muscle. Subcutaneous or hypodermic and then hypo below dermic skin. So iya kuphi beneath or below the skin. Intravenous and then venous. So iya kuphi le kuma veins. Then intradermal and then dermal. So iya kuphi between the layers of what? Of the skin. So it's simple to understand all of that. Then you have the pictures here. You also understand all this for the all of these methods. So there are 18. There are 18. Ayikho engabalulekanga. Kufanele understand all these 18 methods. So when we get time, we look at the sustainable use of medication. From the sustainable use of medication, we go to the types of medication, the definition.